want to welcome everyone to our April advocacy meeting. And we are delighted to have Kim Musheno with the Arc US joining us. She is their Senior Director of Medicaid Policy. She previously held the Director of Policy positions at the Autism Society of America, the Association of University Centers on Disabilities, and the National Association of Councils on Developmental Disabilities. So we want to go ahead and welcome Kim and let her take it from here.
Thank you so much, Dina. And just remind me, how much time do I have?
We allow an hour, so maybe 45 minutes with time for Q&A.
Okay.
And people can either put stuff in the chat or ask as we go along.
Okay. Well, thanks for having me. Yes, I most recently came from the Autism Society of America, but I actually worked at the Arc of the United States in the mid-90s too. I was helping to build the grassroots network participation in federal policy. So while I only started in this role in January, I've been involved working at the Arc or with the Arc for almost 30 years. And now I'm solely focused on Medicaid policy. I also have a family member, my brother-in-law, Bill, is autistic, has intellectual and developmental disabilities. We're lucky enough that he got off the waiting list and has residential services and works full-time above minimum wage at here in Maryland. So let's get started. I'm going to talk about what's going on in Congress and Medicaid, but I'm happy to also take questions about other things that are going on here because there's a lot. But for Medicaid, our strategy has been really targeting education and building relationships, especially with Republican lawmakers, because they're in the majority, and we need bipartisanship to overcome and protect Medicaid from Medicaid cuts. So mostly the Democrats are all in lockstep against any Medicaid cuts. So we're primarily focused on trying to educate members of the Republican members, and then also in key states, which I'll talk a little bit more about. We're trying to make sure that our vast network of chapters and their members are all engaged in Medicaid. And we're doing a very aggressive communications and media outreach, and we're pretty successful. For our grassroots, our staff today just said that we had 230,000 contacts just since the beginning of this year to members of Congress from our grassroots, and that is historic. I mean, we've never had that type of engagement in the past, so that's really great. We want to keep that up. So I can or Dina can send out this PowerPoint, and you can look at some of our recent media examples, and especially encourage you to watch Katie Neese, who's interviewed on CNN talking about Medicaid cuts to education and the changes to diversity, equity, and inclusion policies. So the congressional landscape is that the Republicans have a trifecta, meaning there's a Republican president, Republican House, and Republican Senate, and that makes it easier for the president to enact his agenda, and the House and Senate Republicans to enact their agenda, and they are moving rapidly. As is usual, when there's a trifecta, they try to get all of their agenda items as soon as possible because they know that the, midterms in the next election cycle, they could lose the majority. So they're moving fast, and so we worked hard early in the fall to bring our grassroots up to speed. We had several webinars that you can still see, trying to help people to understand the basics of Medicaid, plus what to do, how to advocate. So where we are is that we know that Medicaid's a target, and they're also trying to reduce the entire size of the federal government. And you can see that Elon Musk and DOGE, or Department of Governmental Efficiency, is targeting the federal government, and not in a legal way, but tearing down agencies, including the Department of Health and Human Services. One of the reasons they want major cuts is because they want to enact or extend the 2017 tax cuts that were enacted. Those will expire, and that's $4.5 trillion worth of tax cuts. And they want to enact further tax cuts. So the way to do that without increasing the debt and the deficit is to make huge cuts to programs, and unfortunately, they're targeting programs that support people with disabilities and low-income individuals, to make tax cuts that mostly go to higher income earners. So the ARC's goal on Medicaid is to try to get bipartisan champions of Medicaid and help them understand how important Medicaid is. So our targets are primarily members with that have family members with disabilities, members who have co-sponsored major disability legislation, or otherwise been a champion for disability rights. And so we've identified those key members, also members that won in a close election. And then we identified the chapters associated with those members, and as well as members of Congress who have voted in a bipartisan manner or considered moderate in reputation. So we have done that, and we're meeting with those targeted chapters every other week to make sure that they're up to date on what's going on, and are doing everything that they can at the state and local level to educate those targeted members. So as I said, Medicaid is the big target. And the reason for this, in part, like I said, they need to cut somewhere in order to enact the tax cuts that they want to renew. And so they look at the budget pie, and they see that Social Security, Medicaid, and Medicare are the biggest part of the whole federal spending pie. And since Social Security and Medicare are so popular, then that's what's making Medicaid the big target. And they've created a narrative around Medicaid as being a welfare program, that there's too many people on it that could be working, that even though most people on Medicaid are working, and that there's a lot of people that just want to be on Medicaid because they're lazy. And this is kind of reminiscent of back in the mid-90s. Some of you might remember when they were making cuts to the welfare program, which is now called the TANF, and they kind of built the same narrative around Medicaid now, which that's why we're trying to put so much focus on what Medicaid is. And as you all know, Medicaid is the biggest funder of home and community-based services and long-term care in general. Our nation has not built a program, a long-term care program. And so we rely, our nation relies on Medicaid for all long-term services and supports, and also home and community-based services. It also, Medicaid touches the lives of people with disabilities throughout their lives. It provides early intervention. The EPSD program is essential so that kids can thrive. So from the time a person has a diagnosis until death. And then it also pays for school-based services. Many people don't understand that Medicaid often is the payer of therapies in schools, communication devices, speech therapy, physical therapy, and so on. And then it, as a transition away from school, it supports people in college and in work. It's a large payer of longer term supported employment, transportation to and from work. It really fills in a lot of gaps. But all of these, a lot of the programs in Medicaid are optional. So even home and community-based services, which we don't feel are optional because they're so important to us, the Medicaid is, it's a federal state program, and the mandatory are things like hospital, some home care, but the optional is also in large part things that we really rely on, like home and community-based services and therapies. And so if Medicaid is cut, then this is a big cost shift to states, and states will have to make up the difference. And I'll get into that a little bit more. So the current status is that the House in February passed a budget resolution, which is the overall framework, the overall big budget number that directs the Energy and Commerce Committee to find savings of at least $880 billion over 10 years. This is an historic cut to Medicaid. And it's not a done deal, but it's just the House version, but it's historic. And there's no way to cut 880 billion, that's 80 billion a year, 88 billion a year over 10 years, without making significant cuts to Medicaid. So the next step is for the Senate to take up the House passed bill. But what we just learned yesterday, so you're getting up-to-date information, is that the Senate is taking a different route. They are setting up a budget resolution at a much smaller number, maybe $1 billion, but they intend to try to get to 880 billion, but they're just putting in a floor so that they can get the budget resolution passed. So in a way, this is a gimmick in some respects, because our grassroots is pushing back on these cuts, and so the Senate cannot agree on a budget resolution. So in other words, you guys are doing such a good job explaining how important Medicaid is that they don't want to make those types of cuts in a public way. Meaning, so they're going to do a budget resolution that is a much lower number, but when it goes to the Senate Finance Committee, they will try to make cuts to those programs to reach the House level. And then once there's a House and Senate reconciliation bills that are the same, I mean, things will move really fast. So a lot of this is very secretive on purpose so that you don't know how they're going to make the cuts to Medicaid.
What do we do?
One thing you should know is the House, well, I'll get into that later, but next steps are, Senate takes up the bill, and that is as soon as this week. We are expecting to see a bill today, a budget resolution. And again, budget resolution is only the budget framework. It's only the overall number. It won't have where the cuts are being made. The Senate will instruct the Senate Finance Committee that has jurisdiction over Medicaid and SNAP and CHIP and other programs. It will instruct the Senate Finance Committee to make, we don't know yet, $1 billion, $2 billion, 300 billion, we don't know yet. And then the Senate Finance Committee will be instructed to change programs like Medicaid to meet the targeted amount. So that's how reconciliation works. It's basically reconciling program changes with the overall budget target. And if that doesn't make sense, just tell me and I can try again. So then the next step, then what happens is the House and Senate have to have a reconciliation bills that are identical before it can be signed into law. They think that they can do this by Memorial Day, but we're trying to slow this down by making it harder for them, going to the town halls, showing up at their offices and so on, and that is working. So like I said, we don't know how they're going to make the cuts yet because they're not telling us. We know that they're talking behind closed doors about how to make these cuts. They're just not telling us how they intend to make these cuts. But we did find out in February that there was a menu released of some of the programs that they're looking at and how they're gonna cut it. And there was a section under that document called Medicaid, making Medicaid work for the most vulnerable, and suggesting per capita caps that would save, according to this document, $918 billion over 10 years, ending Medicaid reimbursements for able-bodied adults, and they think that can save $690 billion over 10 years, and lowering the federal matching percentage, $387 billion savings, adding work requirements, $120 billion, and repealing funding that already went to the states as part of the American Rescue Plan with 18 billion savings. Let me see if I'm, yeah, okay. So we have also heard them talking about, we've heard all of that, block grants, per capita caps, elimination of or reducing the Medicaid expansion, work requirements, limits on acceptable provider taxes, and other ways states meet their match. We also heard, in addition to those, that they want to repeal some of the regulations that were passed during the Biden administration that actually makes the Medicaid program work more efficiently. And it smoothed the way towards eligibility. And also there's a rule related to the quality of Medicaid programs by making sure that direct support professionals and nursing home staff are better funded, and making sure that there's additional staffing hours, enough staffing hours, so that the quality of care is better. They want to get rid of that. So let me go through each of these really quickly. So block grants are, if you're not familiar, would be a specific amount that goes to each state that would then rise slowly over time, but it would change the entitlement nature of Medicaid. In other words, right now, when the eligibility goes up, like more people are eligible, then the Medicaid dollars rise. When when there's less of a need, then it recedes. So for example, during COVID, the number of people eligible went up because the need was so great. But now post-COVID, spending on Medicaid is going down. So if there was a block grant or per capita caps, which is just capping the amount per person, in times of emergency, that would make it difficult for states to respond by increasing the number of people eligible for Medicaid. And in block grant or per capita cap situation, it would not respond and go up over time in the same way that the entitlement nature of the program does. And it also doesn't rise with the increased health costs. So that block grants or per capita caps would be a huge cost shift to states. And like that or any of these cuts would make it difficult for states to respond to the needs of their constituents. And when that happens, then the optional programs are the ones that be cut first. So that includes Medicaid home and community-based services. For example, a lot of people get services through the Medicaid waiver. Dina, did you have a question?
We did have a question in the chat. So who manages the grant funds?
It's a federal state partnership. So there are Medicaid state offices in every state. At the federal level, it's the Centers for Medicare and Medicaid, which is under the Department of Health and Human Services.
So Dawn, did that answer your question? You can just nod or,
You can speak.
okay, if you can't unmute, that's fine.
Yes.
Okay,
All right,
great.
good.
That's a great question. So yes, again, it's a federal state partnership. And so the federal government provides a certain percentage to each state, and it's more money in states that have less wealth per capita, and less in states like my state. It's 50-50 percentages, but it can go all the way up to 85% like Mississippi. And then states have to match it, and they have to find funds, usually through taxes or provider taxes, to match that. So good question. So some of the other proposals that are that we're hearing on the Hill during our Hill meetings are eliminating or reducing the Medicaid expansion. That's a program that was enacted with the Affordable Care Act. The reason for that allows additional folks to benefit from Medicaid that are low income. So those up to 138% of the poverty level are eligible, and the federal government, to incentivize states to do that, because it was the most efficient way to get more people health insurance that they needed. So it literally helped to reduce the uninsured by 20 million people. And to incentivize states to take up this expansion, they incentivize states by providing 100% of the match in the beginning. And now it's, and then it reduced it over time, and now it's 90%, but still much higher than 50%. And so this is why some members of Congress don't like this and think it's unfair, especially those states that didn't take it up. There's 4 states that didn't take it up. No, I think it's 9 states that didn't take up the expansion. And so they're talking about reducing the federal match to make it even with the other parts of Medicaid. Part of the problem with that is one, states might not take it up then. And in some states, there's actually, they've passed legislation saying that if the federal government changes the FMAP or the federal matching rate for the expansion population, that they will automatically end the program. And this will result in, currently 15 million people benefit from this, and it helps them work. It helps them get to work. Another way they might make these cuts are what's called work requirements. And work requirements are basically a cut. It's a paperwork burden. If they feel like, again, that there's these lazy people that are on Medicaid and they're not working, but really most people in the Medicaid expansion population are working. They just might have a disability or, a chronic disease or cancer, or they're gig workers or farm workers that are seasonal, and their work doesn't provide health insurance for them, and they're low income enough that they qualify for this. And so work requirements would make people have to show that they are trying to work or going to school or doing some other activity. They'd have to prove these things to maintain their Medicaid. But we know from past examples in states that have tried this, that all it did was result in people losing their eligibility for Medicaid. So it takes away, it doesn't help people get to work, it just takes away their health care. In Arkansas, for example, when Arkansas tried to implement work requirements, within 7 months, it resulted in 18,000 people losing eligibility for their health care through Medicaid. So they quit it. They quit the work requirements. But now it doesn't matter that this has been one of the most popular ways for members of Congress to implement cuts to Medicaid programs. They say there's dignity in work and people should be working to get Medicaid. But they're also understanding that this is a cut, because this is a big way for them to make the massive amount of cuts that they want to make. Another way that we were hearing on the Hill is that they'd like to limit provider taxes or other ways that states meet their match. Well, I mean, that's just a terrible idea, because how are states going to meet their match? They're not able to meet their match, then they're going to lose Medicaid, and they will have to cut services to people. And then finally, the other that's not on here, but what we just heard a couple days ago is that taking away, repealing regulations that passed during the Biden administration that actually streamline the Medicaid program and provides other protections. So, our message is any cuts to Medicaid are going to hurt people with disabilities. So as I mentioned, that one of our biggest talking points is what a huge cost shift this will be for states. If states don't get the matching, the FMAP, then they're going to have to cut eligibility or reduce services, because most states will not want to, especially Florida, they're not going to want to raise taxes. So this is going to lead to decreased eligibility for services and increase wait lists. So our message to you all is to make sure that you're not just educating your federal members of Congress, but also educating governors and state legislators who care about the economy of Florida and who might understand that what a cost shift this will be. And then it'll be up to governors and state legislators to make up for this huge cost shift and either raise taxes or drastically cut services. It's also it's a big economic driver. These Medicaid programs actually have a lot of help states with a lot of jobs. It's a big employer. So we're hearing a lot of different basically myths on the Hill. And also some of our chapters are telling us that their constituents are talking to their members of Congress and getting a response that that the president said he's not going to cut Medicaid, that in fact, the president said he loves and cherishes Medicaid. But then 2 days later, he said he also supports the House passed bill that drastically cuts the Medicaid program. Some members of Congress tell constituents that Medicaid is not mentioned in the budget resolution. And that's correct. The budget resolution is only a budget number. Then it's only through the reconciliation process that the actual programs are cut. So again, the budget resolution directs committees that have jurisdiction over Medicaid and other programs to make the cuts to correspond to the overall budget number. So I think it's very disingenuous when members of Congress tell their constituents that Medicaid is not mentioned in the budget. It's not fair. Some members say that they're not cutting anything for beneficiaries. They're only cutting waste, fraud, and abuse, not hurting beneficiaries. Again, there's no way to make an historic cut to Medicaid of $880 billion over 10 years and not hurt beneficiaries. Medicaid is a very lean program, which is why it was used to expand to low-income individuals that otherwise couldn't get insurance. And as you all know, the pathway to Medicaid through the Social Security program is very hard. It's hard to get SSI, for example. So it's already a lean program. There's already mechanisms to audit the program, and they are working. And the answer to waste, fraud, and abuse is to increase staff at CMS who do the auditing.
One quick question. Someone asked, can we get infographics to share with our legislators? So whatever kind of collateral, if you could send to me, then we can distribute that.
Sure, you bet. We have a whole toolkit.
Great.
But infographics, I'll have to look into some infographics.
Jaro, you want to explain what you're specifically looking for?
Hi, this is Hyro. Yes,
I'm sorry, Hyro.
I was wondering, like when we present information to our legislators, we have I think depending on which side of the aisle you're speaking, because this is money, this is finances, budgets, and sometimes I feel like it goes a little bit over my head.
Yeah.
And get the right terminology.
Yeah.
And to go like, this is a good return on investment, a good
Yes.
ROI. So it's like, you only have like 3 minutes to explain why this is why we need this, and to kind of go in.
Yeah, there's a good, you're reminding me that the Center for American Progress actually has a really good graphic, and I'll, Dina, if I don't send it to you, remind me.
Sure, no problem.
Good question. Thank you. So were there others while I was gone? Okay. So some members are also saying that they're only supporting work incentives because there's dignity in work. Like I said before, they're talking about this work requirements, which really is just a paperwork burden, and because they know that it's confusing, it's burdensome, that they want things to be more efficient and get rid of waste, fraud, and abuse, but then they want to pile on paperwork burden to make people go through hoops to get their health care needs met. So what can we do? So like I said, we're really trying to activate our chapters, and get them to work with all of their members in the states. Really impactful on the Hill are the stories that we've collected in our action center. We have an action alert, and we also have a story bank. So you can go to our action alert or our action center and write to your members of Congress and tell us how Medicaid impacts you. And then we are sending those to the Hill. But you can also use your own voice to write to your member of Congress, or make a video and send it to them. You can tweet it to them, or use other social media ways to get to them. But stories really are the most impactful. The more people that are going to the town halls when they have them, or visiting them when they're home, the more people that are making actions, it really has been making a difference. So we've been engaging with our chapters, making sure that we started with webinars last fall, and those are still available to you if you want to do a deeper dive. For example, we have one just on how Medicaid is funded. We've been meeting every other week with our chapters, and we've created a toolkit, which I'll get to. So I wanted to give you some talking points, and Dina has our state profile. If you don't, I'll send it to you, so that when you're talking to your members of Congress, you can talk about Florida and how Medicaid impacts your state. So it's providing access to long-term care to more than almost 4 million people in Florida, and 29% of people with disabilities under age 65, 40% of children, 238 adults in Florida are receiving long-term services and supports. Medicaid and home and community services enable 177,000 people live, work, and participate in their communities. The federal government spent $22.3 billion on Medicaid in Florida in 2023, providing about 65% of the total cost of the program in the state. So that's your FMAP, 65%. Cuts to the and as I mentioned before, cuts to Medicaid funding would shift costs onto Florida, squeezing in already tight state, local, and family budgets. And I have a fact sheet that has that on it, so you don't have to write it down. I can make sure that Dina sends it to you. So I looked up some of your members and what committees that they're on, and you actually have a lot of members of Congress in Florida that are on the Energy and Commerce Committee. That's the House committee that will be responsible for making the changes to Medicaid, SNAP, CHIP, and other health programs to meet that top line of funding cuts. So That's Kathy Castor in the 14th district, Gus Bilirakis on the 12th, Neil Dunn in the 2nd, Soto in the 9th, Kat Kamak 3rd, Lauren Lee is brand new to the Energy and Commerce Committee. So those are all, we consider those all VIPs and key targets because of the committee membership. And then your 2 senators are Rick Scott and Ashley Moody. Rick Scott is hard, a hard one because he voted against the Affordable Care Act, and he was against Medicaid expansion. Then when he was running for office, he was for it, and now he's against it again. So he's tough. And then Ashley Moody is newly elected, but she is on the Senate's Health, Education, Labor, and Pensions Committee, which is an important committee related to health. So if any of those members, both senators, are yours, but you know, if you recognize any of these members, then it'd be really great if you could reach out to them. And then we created this chapter toolkit, and it's also online. We, you know, early on, we wanted to make sure that everybody was educated about Medicaid. So it's got things like key talking points, of course, but also even words to know, because there's so many big words related to Medicaid. So we tried to spell those out. We have a Medicaid funding explainer. We wrote an issue brief on work requirements, since we know that that's one of the ways that they want to make cuts to people, to help members of Congress and the public understand what they are. They're not about dignity to work, as they're saying. Data, stories that you can share, a sample welcome letter, and then a couple graphics to use on social media. So those are all available on our website. And then this is our action center that I was talking about. This action alert, you don't have to even know who your members of Congress are. All you need to enter is your address, and then and there's a sample letter on Social Security. We also have an action alert up right now on, Medicaid. We also have one on Social Security and education, if you care about those. And so you don't even have to know what to say. There's a sample letter there, but you can edit it. And we always encourage you to edit the letter, the sample letter, to make it more personal about your family. It takes probably 3 minutes to take an action that way. And then if you want, then your information will be saved and you'll get future action alerts. And then this is the story bank that I was telling you about. You can share your story, and when you do, that then gives us permission to take your story to members of Congress. And here are links to those as well. We had, now this says 175,000 actions this year. It's actually now, as of yesterday, 230 actions already this year, which is amazing. So next week, we are having our annual disability policy seminar at April 7th through 9. It's right down DC, and I hope some of you already signed up for it, but it's not too late. You can even arrive and register. But this is our biggest event. We have almost 900 people registered already, and it's a day and a half of intensive workshops, followed by a whole day of going to Capitol Hill. And this year we're focusing on Medicaid, of course, funding for disability programs, and education. But there's also a panel that will focus on Social Security. We also have 101s, like very basics on Medicaid and Social Security at this forum. So we're really excited about this, and it's a beautiful time of the year to be in Washington. Oh, and we also have a rally on Wednesday right before the Hill visits. So hope that some of you can come, but even if you can't, you can go to disabilitypolicyseminar.org, and we have our fact sheets that we are sharing with folks on education, funding, and Medicaid. And those are all available to you to use if you want to educate your members, and we hope you do. There's an upcoming recess. The House is on recess for the next 2 weeks. The Senate will be on recess the week around Easter. And that's a really good time to meet them while they're in their state or district.
Great. Thanks so much, Kim. We've got time for maybe a few questions. If people have specific questions, you can either put them in the chat or unmute yourself. I know we're going to send out the toolkit to everyone. We're going to send out a copy of this presentation as well. And if there's any, and we'll also put Kim's email contact as well, so people could contact her directly. So do we have anyone with a specific question or anything? Everybody's just soaking in all that information.
Yeah, I know that's a lot in a short time, but I'm happy to expand on anything.
Well, great. Well, we appreciate it so much, Kim, for you taking the time.
You bet.
All right. So y'all have a good rest of the week, and we'll see you next time.
Will I see you next week, Tina?
No, unfortunately, not this year.
Okay.
This year.
All right. Thank you.
Thanks.